Oh, hello. Who have we got here then? Okay. Yes, I can see we've had a sick call from you today. All right. Let's just check here. So, you're not feeling too well today. Okay. Could you tell me what's wrong then, please? All right. So you've got a sore throat. Okay. And you feel achy. All right. Okay. Headache. Okay. And where's your headache? Okay. Just across the front? Yeah, okay. How are your ears feeling? They're feeling achy too? Alright. Okay. Are you feeling hot, cold, shivery? Okay. And how long have you been feeling like this? Since yesterday evening, okay. But you've woken up feeling worse? Alright, okay. Alright. Are there any other symptoms that you've got you'd like to share? Okay. Do you just feel really tired, yeah? Okay. And you think you have a little bit of a rash on your chest and arms, alright? I'll check that out. Okay. I'm not aware of anyone else here at the moment with those symptoms, but we may get other people if it's a viral infection. Alright. Have you suffered with tonsillitis before? You have, okay. Does that feel similar to what you have now? Okay, possibly so, alright. Okay. Are you eating and drinking normally? Okay, you've been drinking plenty of fluids, that's good. We always advise that. And foods, your appetite's pretty poor, okay. Any abdominal pain? A little bit, okay. Alright. Any nausea? No, just really loss of appetite, okay. Alrighty, okay. Just having a little check through some previous history. We haven't got you on any other medications here, have we? No? Okay. That's good. Any allergies to any medicines or antibiotics particular? Okay. That's good. Right. Okay. First things first, I'm going to pop some gloves on, if that's okay. Right, I just want to take a little look at your skin, alright? Okay, so let me just check your left arm here, alright? Okay. I'm just going to get in a little bit closer to have a look. Just pop a light onto that. Okay. There does seem to be a little bit of a rash. You're correct. That could be due to the infection itself. Some people get a rash with infections. Okay, let's just have a look at this side. Thank you. Is it itchy at all? Okay, and I'll just have a little look at your chest. Just have a little look there. Tiny little bit of a rash there as well. Okay, and just over here I can see just a little bit too. Okay. All right. Just keep your head nice and still for me. I'm just going to palpate your lymph nodes in your neck. All right. Tell me if anything feels uncomfortable. Okay. Just on the sides of your neck. Anything feel uncomfortable there? Okay. Just across your shoulder. Okay. Just under your jaw. Okay. All right. The lymph nodes feel a little bit swollen. Okay. So it looks like we're dealing with an infection of some kind. Okay. Right. I'm just going to take a little listen to your chest. You don't have a cough at all? Not at the moment? Okay. Let's give this a little warm up. Okay. Great. Just going to pop the stethoscope onto your chest. Okay. Just take a nice deep breath in for me. That's good. And out. Okay. And again. And out. Okay. And again. And out. That's perfect. And again. Okay. Could you just do a little cough for me? A little Okay. I'm just going to pop the stethoscope just onto the side of your neck a second. Okay. There we go. Just keep very still and breathe normally. Okay. Well, your chest is sounding clear at the moment, which is good. Okay. So I'm just going to check your blood pressure. All right. Before I move on to looking into your throat and ears. All right. I'm just going to put this cuff around your arm. Outstretch your left arm for me. Thank you. There we go. Let's pop that on there. Okay. And just got to pop the stethoscope onto your arm. There we go. And this will go tight. I'm sure you've had this done before. Okay. All right. I'm just going to inflate the cuff now. Okay. breathe normally and relax. Thank you. Okay, that's all right. I'll check it on the other side if that's all right with you. Good. Okay. There we go. That feels better, doesn't it? Okay. Let me just pop it onto the right arm just to make sure. I like to check both sides. Okay. There we go. Let's pop the stethoscope on there. And I'll just inflate again. All right. Keep nice and still for me, thank you. That's good. It's the same on both sides. There we go. Perfect. Well, that bit's checking out all right. Your blood pressure is very healthy at 118 over 80. You're clearly nice and fit, apart from not feeling too well at the moment, which is what we'd expect here. Okay. Just update that there. All right. Okay. So what I'd like to do next is I'd like to do an inspection of your throat. Alright, have a little look down your ears too. Okay, and check out the areas that aren't feeling too good. Alright, okay, I'm just going to grab a mask and I'll be back with you. Okay. Okay. I just need to take your temperature. Alright, so I just need to put protective cap on the end there. Okay, and I'm going to be inserting this into your ear. Alright, it won't hurt, it will beep, but that's all, it's very quick. Okay, so I'll pop in with your left ear if that's alright. Okay. Here we go. Just going to pop that gently in there for you. Okay. Alright, take that down now. Okay. Right, so you are running a fever. Okay. Your temperature's 38. We need to get that down a little bit, don't we? Okay. Alright. So I'm going to have a look in your throat. Okay. Get a new tongue depressor. Alright. Okay. I will shine a little light down there as well. Alright. So what I'd like you to do is open nice and wide for me. I know it may be uncomfortable at the moment. Okay. Nice and wide for me. I'm just going to pop this into your mouth like that. Alright. And just shine light down there. Okay. Can you say R for me? Okay. R again. I know it's uncomfortable, I'm sorry. Right, okay, yeah, you've got spots in the back of your throat. Your tonsils are definitely enlarged there. It certainly looks like tonsillitis. Definitely. Okay. Right, so I'm just going to move your tongue up a little bit, okay? Look underneath, okay? Just going to move your cheek to the side. Have a look there, okay? And I'm just going to move the cheek this side and just take a look there. Just a nice little look. Okay. Yeah, alright. That's not looking all that pretty in there, I'm afraid, but I guess you could tell it wasn't going to. Alright. Just going to take a little look up your nose with this. That's okay. Alright. Just going to lift your nose a little bit and just gently insert this just at the edge. I'm not going to be putting it right up your nose. Okay. Alright, just raise your nose up there. Just a little bit. Okay. Alright. And this side. Okay. That looks alright up there. You had no sneezing. It doesn't look like you've got any discharge from your nose there, okay. Alright. I'm going to check in your ears now. That's alright. Now, again, I'm going to use this inside your ear, just has a little light in it. Now I'll need to pull up and back very gently on your ear, okay? Insert this otoscope and then I'll take a look around. If it feels uncomfortable, you must let me know. Okay. So before I start, I'm going to palpate around the ear and you must tell me again if anything is feeling a little bit sore. Okay? Alright, so does that hurt at all? Okay, just palpating around the earlobe. Is that hurting at all? A little bit sore there, and around the top of your ear there. Okay. Alright. I'm now going to insert the otoscope. Alright, keep nice and still for me. Thank you very much. Okay, I'm just going to go in there now. Alright, just up and back on the ear. Right, let's have a little look inside. Right, your ears are looking a little bit inflamed, but that's quite common if you've got an infection like tonsillitis or another upper respiratory tract infection. They do look quite red. There's a normal amount of earwax, that's not your problem. I think they're just a little bit agitated with the infection that you've got going on. I can see your eardrum, so that's okay. There may be a little bit more fluid than I'd like to see there, so that would be causing you some discomfort, but again, that's very typical if you've got a throat infection of some kind. Okay. Alright, I'm going to withdraw the otoscope now very gently, okay. There we go. Well done. So, I'm just going to palpate around your right ear now. Alright. Okay, just tell me if anything hurts. Okay. So just palpating around the lobe of the ear. Okay. Up the ear, a little bit sore. Okay. And up the top of the ear there. Alrighty. Okay. I'm just going to pop the otoscope in again now. Okay, I'm just going to pull up and back on your ear very gently and insert the otoscope now. Okay, there we go. again, yes, as I'd expect, this ear is looking quite red and angry too. Can't really see much fluid on this one though, behind the eardrum. Normal amount of wax, but yeah, it does look a little bit angry in there. Is that sore? A little bit achy, okay. Alright. Okay. Alright, I'm going to withdraw that now. There we go. Well done. Okay. Well, I can clearly see that you do have tonsillitis. It certainly looks that way, okay, which will be affecting your ears, your head, making you feel rather unwell, and you have the fever too. Okay, so I'm going to put some drops inside your ears. They're an antibiotic drop, okay. I will give you some oral antibiotics as well, and you'll need to take some pain relief like paracetamol, okay. Yeah. You got some of those, right? That's fine, that's fine. But I will give you a script for some antibiotics, okay, afterwards. Alright, so the drops will make your ears feel a lot more comfortable, less irritated, okay? And then you can take those with you. Alright, good, okay. So, let me just get these. Some paper here to wipe any drops away. These are very soothing and they soothe very quickly too. Okay. They're looking good. Alright, let's do your right ear first, eh? Just going to pop a couple down. Alright, keep nice and still. Okay, just coming around with that now. Okay. So there's 1, 2, and 3. There. Wipe some nice paper. Okay, and just a little massage just on the ear, just to work that in. There we go. How's that feeling? Good. Right, let's do this one. Keep nice and still for me. Okay, next one. And 2. And 3. A little massage just to rub that in a little bit. Okay. There we go. Hopefully that'll start feeling better soon. Okie dokie. Right. Just need to do a prescription, okay? Just to pop over and get the antibiotics. Okay, I want you to take these 3 times a day, 3 times a day for a week. I also want you to go and have rest for at least 48 hours. No duties for 48 hours. Okay, if you start to feel worse, come back. Alright, and if you're not feeling that much better after 48 hours, please let me know. Okay. Let me just do this for you now. Okay, so I need to get you some phenoxymethylpenicillin. Okay, 100 milligrams. 1 CDS. Okay, at 7 days. That's okay. 21 of those. Okay. Okay, so here's your script. There you go, take that. So, drink plenty of fluids, okay? Water is best, okay? A squash, whatever you've got there, but, you know, just drink plenty and plenty of fluids. You're okay to take the paracetamol at the same time, okay? We obviously want you back in duty as soon as possible. Yeah, but obviously I think you have a rather nasty infection in here, and we need to get that cleared up before we can have you back on duty, I'm afraid. Yeah, I would like to say in a couple of 3 days, but if you're not feeling up to it, then we need to reassess that then, don't we? Yeah, because we do need you in action. But obviously, everybody gets sick from time to time, and it might be, that you might feel much better within the 48 hours, but we'll take it as it comes. Okay, so keep me posted on how you're feeling. Okay. Right, well, you're free to go on your way and get your medicine, and then go and get that rest, okay? Yeah, okay. And be sure to report back, right? And if you really don't feel any better or feel worse, you do need to come and see me. All right then, off you go. Take care. Bye-bye.